Let us go to diagnosis through the tongue. The topic is color. Observing the color of the tongue is also an important criterion of this diagnostic examination. A healthy person's tongue is usually pale red. If the tongue looks red, it means there is heat in the body. If the tongue is pale, it means that there is cold in the body and a deficiency is possible. If the tongue appears purple, it means blood stasis in the body. Different colors of the tongue reflect different health conditions in the human body. Pale tongue. This refers to a color that is lighter than normal, or more white and less red, or even completely bloodless. This is because insufficient yang results in the weakening transformation function of blood yin and a weakened flow of blood. As a result, the blood cannot fully nourish the tongue, rendering it pale and white, which is an indication of deficiency of both qi and blood. Pale tongue texture, bulky and tender with teeth impressions, indicates decline of yang. Pale tongue texture, slightly shrunken in size, indicates deficiency of both qi and blood. Light but still visibly red tongue indicates early phase of deficiency syndrome. Parched white, bloodless tongue with white lips and gums indicates more severe deficiency syndrome. Bright red tongue. When the tongue is bright red, that is darker than normal, it is called red tongue, indicating a heat syndrome, which is due to retention of hyperactive heat in the body, leading to fluid depletion. Red tongue tip with prickles indicates flaring up of heart fire. Red tongue with yellow and dry coating indicates excessive heat in the body. Red tongue body with little or no coating indicates endogenous heat due to yin deficiency. Red tongue side indicates mostly hyperactivity of heat in the liver and gallbladder. Purplish red tongue. When the tongue body becomes dark red, it is a sign that the heat pathogen has invaded the blood. Due to the hyperactive yang and heat, qi and blood flow accelerates and fill the meridians and collaterals to the brim, resulting in a bright red or purplish red tongue body. This is often associated with factors such as high fever, dehydration, coma, or vitamin deficiency. Purplish red tongue, dry body with prickles or cracks indicate hyperactivity of endogenous heat penetrating to the nutritive and blood stages, which is a syndrome of excessive heat. Dull color with little tongue coating or some cracks indicates syndrome of yin deficiency. Purplish red in tongue center indicates spleen and gastric heat. Pale tongue with a tinge of red indicates mostly hyperactivity of deficient fire. Purplish blue tongue. Part or whole tongue body looks purplish blue, which is called purplish blue tongue. This type of tongue signals a dysfunction of the flow of qi and blood, resulting in the tongue looking purplish blue. It is often related to venous stasis, slow blood circulation, obstruction of microcirculation, lack of oxygen, and a deformity of the capillaries. Whole tongue looking light purplish blue, smooth and moist, shrunken tongue body indicate invasion of cold pathogen, leading to a state of yang deficiency due to yin excess. Whole or sides of tongue looking purplish blue and dull, with blood stasis spots on the sides indicates blood stasis obstructing collaterals. The tongue often appearing purple indicates a warning sign of the onset of cancer. Thank you so much for your attention.
Let's talk about the types of pain and their pathology under interviewing. So we have here a table where you differentiate the types of pain and their patterns. So for soreness, there is dull ache that usually occurs in the forelimbs or trunk. The patterns would be either deficiency condition or dampness. If the pain has a feeling of heaviness, or this is what they call heavy pain, there will be dull ache accompanied by a sensation of heaviness. This usually occurs in the limbs, head, or the whole body. Patterns would be dampness or phlegm. Distending pain or bloating, there will be subjective bloating sensation. Bloating also may be felt on palpation when the area feels distended like a balloon, and this is seen on observation. Pattern is qi stagnation. Pain with feelings of fullness. The patient feels very full, as if after a heavy meal, perhaps also with a slight nausea, and the area feels hard rather than distended on palpation. Fullness cannot be seen on observation. Pattern is dampness. Ache with feeling of emptiness. This often occurs in the head. Pattern, chi and blood deficiency or kidney deficiency. Pain with feeling of cold, sharp stabbing or spastic pain that is clearly accompanied by a pronounced feeling of cold or even shivering, and that is alleviated by the application of heat. Pattern, full or empty cold, usually in the abdomen or limbs. Burning pain, there is pain with a burning sensation. Pattern, full or empty heat, usually in the epigastrium or in the limbs. Colicky pain, this is sharp pain of a colicky, cramping nature. Pattern, cold in the intestines, blood stasis, usually in the epigastrium or more usually the lower abdomen. Spastic pain, this is sharp pain accompanied by spasm, which is contraction or a sensation of spasm. Pattern, liver blood deficiency in conjunction with liver qi stagnation or liver yang rising, usually in the limbs or head, and is related to the sinews and therefore the liver, either of full nature or a combination of deficiency of liver blood and fullness, stagnation of qi. Dull ache is very mild pain. Pattern, deficiency, usually chronic, long duration ache. Pain with distressing feeling. This is pain accompanied by a restless, undefined, anxious feeling and perhaps palpitations, usually in the epigastrium or chest. Pattern, retention of phlegm in the epigastrium, affecting the heart or rebellious qi in the penetrating vessel. Pain with sensation of stuffiness. There is pain with a mild feeling of fullness while the abdomen feels soft on palpation, usually in epigastrium or chest. Pattern, deficiency of the spleen and fullness, heat or phlegm. Pushing pain. Sharp pain accompanied by a feeling as if something was pushing the area, usually in the hypochondrium or epigastrium. This is severe qi stagnation. Pulling pain. There is sharp pain accompanied by a sensation as if the skin were being pulled, usually on the head. This is liver wind. Cutting pain. Very sharp pain that feels like a knife, usually in the lower abdomen. Blood stasis, definitely full in nature. Throbbing pain. Severe pain feels as if there was a throbbing or pulsation, usually on the head, very common in headaches from liver yang rising. Pattern, liver yang rising. Boring pain feels like the stabbing of the tip of a knife blade, a nail or a screw. It is fixed in location, usually in the lower abdomen, epigastrium, hypochondrium, chest or head. Pattern, blood stasis, full in nature. Lurking pain, pain that is not severe, not acute, relatively easy to endure, but chronic and persistent. In Chinese, called yin tong, which means latent, hidden, or lurking pain, usually improves with the application of heat, generally in the abdomen or lower back. Pattern, qi and blood deficiency or empty cold in the interior, leading to malnourishment of fire channels. Now, let us differentiate the pain resulting from deficiency, resulting from fullness, cold, and heat. If the pain is due to deficiency, applying pressure would alleviate it. If it's due to fullness, pressure would aggravate it. Food will alleviate the pain resulting from deficiency, and the pain is aggravated by food if this is due to fullness. If the pain is due to cold, food will alleviate, hot food will cause an alleviation, and cold food will aggravate it. If the pain is due to heat, cold food will alleviate the pain, and hot food will aggravate it. So the type of pain, if it is due to deficiency, it is dull or lingering pain. If due to fullness, it is sharp. If cold, it's cramping, spastic. Heat, burning. Temperature. The pain due to cold, if you apply heat, the pain will be alleviated. And pain due to heat, applying cold would alleviate pain. Bowel movement will aggravate the pain resulting from deficiency, while bowel movement will alleviate the pain resulting from fullness. And if the pain results from cold, the bowel movement would aggravate it. Pain resulting from heat, bowel movement will alleviate it. Posture. The patient would feel better lying down if the pain is due to deficiency. If the pain is due to fullness, the pain is better sitting up. Pain resulting from deficiency has a slow, gradual onset, while pain resulting from fullness has a sudden onset. Vomiting will aggravate the pain caused by deficiency and alleviate the pain caused by fullness and cold. And vomiting will alleviate the pain caused by heat. And finally, the pain will be alleviated if the pain is due to deficiency. The patient feels better with rest. And if the pain is due to fullness, the patient would feel better with exercise. If the pain is due to cold, it's better with exercise. And if the pain is due to heat, the pain is rest or the feeling would be worse when the patient would exercise. Thank you for your attention.
Let's now proceed to pattern discrimination and discuss about location of pain and channel association. Location of the pain can be associated to the acupuncture channels that traverse the region. This can also be used to determine treatment by choosing points along the course of the affected channel, even if they are not at the location of the pain. So, if it involves the liver and gallbladder channels, the pain can be felt at the vertex or temporal region of the head, the ear, the costal region. If there is hepatitis, cholecystitis, it can also be felt in the lower abdomen, the inguinal area, the interior aspect of the thigh, in the yin organs, and there can also be eye pain. If the pain involves the heart and small intestine channels, pain can be felt on the external canthus, and the face, the chest, the scapula, the interior aspect of the arms. There will be a painful tongue, a true heart pain, and painful urination. If the pain involves the spleen and the stomach channels, there will be frontal headache on the forehead, or pain on the forehead, pain on the upper teeth, pain on the tongue, pain at the stomach duct, upper abdomen, and the lateral aspect of the legs. If the pain involves the lung and the large intestine channels, there will be pain in the nose, the throat, the lower teeth, the shoulder and back, the chest, the anus, and the elbow. If the pain involves the kidney and the urinary bladder channels, there will be vertex headache or vertex pain, pain in the spine, in the back, in the lumbar region, in the coccyx, and the lower abdomen, and the feet, and toothache and ear pain. So for pattern discrimination in common pain conditions, we have headache discrimination, chest pain discrimination, costal pain, stomach pain, abdominal pain, back pain, lumbar pain, limbs pain, and generalized pain. Thank you for your attention.
Let's talk about differential diagnosis of diarrhea in Western and Chinese medicine. Western differentiation of diarrhea. Acute. Gastroenteritis, bacterial, viral, or protozoal. This is nausea, vomiting, fever, loss of appetite, abdominal pain, cramps, and bloody stools. If it is due to food poisoning or non-microbial, there will be nausea, vomiting, cramps, fever, weakness, and headache. If it is caused by medications causing diarrhea, They may be taking antibiotics, laxatives, thyroxine, and digitalis. If diarrhea is chronic, it may be an irritable bowel syndrome. So they may have chronic frequent diarrhea, may be alternating with constipation, pain after eating, distension, and flatulence. If it is malabsorption syndrome, there's food intolerance, bloating, flatulence, growth failure, or weight loss. If it is food allergies and food intolerances, there will be abdominal pain, cramps, nausea, vomiting, itching of eyes, mouth, throat, hives, nasal congestion, runny nose, wheezing, difficulty swallowing. If it is diverticular disease, there will be diarrhea and constipation, left lower abdominal pain, rectal bleeding, and it occurs in older people. If this is bowel cancer, then there will be diarrhea and or constipation, blood in stools, anemia, abdominal pain, intestinal obstruction, and weight loss. If diarrhea is inflammatory, then there may be ulcerative colitis, and they will have diarrhea, blood and mucus in stools, tenesmus, fever, weight loss, abdominal pain, and borborygmus. If it's Crohn's disease, it is as ulcerative colitis plus it affects small intestine. This is often more severe. If the diarrhea is endocrine, then there will be hyperthyroidism, and they will have frequent bowel movements, weight loss, increased appetite, restlessness, menstrual irregularities in women, goiter, wide protruding eyes. If it is due to diabetes, then there's increased thirst, increased urination, weight loss, and fatigue. If it is Addison's disease, they will have chronic diarrhea, extreme weakness, fatigue, weight loss, nausea, vomiting, darkening of skin, and mouth lesions. Now let's go to the Chinese differentiation of diarrhea. Diagnostic questioning will be according to, first, type. If it is explosive, then it's external pathogen heat toxin. If it is frequent watery stools, it is spleen kidney yang deficiency. If it is foul smelling, this will be damp heat or retention of food. If it is alternating with constipation, it may be liver qi invading spleen. If it is mucus, then there's damp phlegm. If it is undigested food in stools, there is spleen or kidney yang deficiency. If it is tenesmus, it is damp heat. Now, if it is diagnostic question according to the color of the diarrhea, if it is very dark, it's due to heat. If it's very watery, it's cold or qi yang deficient. If it is pale yellow or green, damp heat in the liver or gallbladder. Third, if it is timing, the diarrhea is early in the morning, then it may be a spleen kidney yang deficiency. If after eating, it is spleen qi deficiency. And other accompanying symptoms, if there's cramping pain that precedes it, then there's stagnation of liver qi, damp heat, summer heat. If there's pain afterwards, after the diarrhea, then there's deficiency. If there's abdominal pain or borborygmy, then there is food retention. If there's emotions and stress after diarrhea, then it's liver qi invading spleen. If there's bad breath and belching, then there is food retention. If there's fever, aversion to cold, then there's damp, cold, heat. If it is fixed lower right abdominal aching pain with palpable masses, purplish black blood clots with stool, then this is blood stasis. If lower right abdominal pain worse on pressure, then this is damp heat stasis and stagnation. Fourth is its etiology. If it is external evil, then it is cold, damp, summer heat. If due to irregular diet, then spoiled foods, phlegm forming foods. If it is an emotional strain, thought, sadness, anger. Then diarrhea can also be due to overwork and chronic illness. Then 6, the Zanko patterns. If it is an excess, there's damp heat in the large intestines, cold invading the large intestines, there's damp heat in the spleen, cold damp invading spleen, food stagnation in stomach, heat toxin, blood stasis, or liver qi invading spleen with damp obstruction. If there is deficiency, it is spleen kidney yang deficiency, kidney qi yin deficiency. Thank you for your attention.
Let's talk about irregular organs. This time we focus on uterus. The uterus is located in the lower abdominal cavity of the female and is the female reproductive organ. Its lower opening is connected to the vagina. Its main physiological functions are as follows. The first one is menses. The uterus is the organ that produces menses. In general, from about 14 to 49 years of age, females menstruate roughly every month. That is, the menses come on schedule. In the development of the female body, regulated changes take place in accordance with the rise or decline of kidney qi. When essential qi of the kidney reaches a certain level, the substance tiangqi is produced. When tiangqi reaches a certain level, the two meridians Ren and Chong become patent, and regular menses result. Both Ren and Chong meridians start from the uterus. When tiangqi arrives, qi and blood flow smoothly through these two meridians and become abundant. They pour into the uterus, ensuring both menstruation and preparation for pregnancy. Hence, there are the sayings. The Chong meridian is the sea of blood, and the Ren meridian controls nourishment of the fetus. In the elderly, as the kidney's essential qi declines, so does tiangqi. Qi and blood that course through the Ren and Chong meridians decrease, and the woman enters into menopause. Clinically, dysfunction in the Ren and Chong meridians can lead to disorders of menstruation, even amenorrhea. Second, gestating fetus. Once a woman's uterus matures and her menses have become regular, she has the capacity to conceive and to give birth. The uterus must supply the nutrition for the fetus. In Chinese medicine, the physiological activities of the uterus is closely linked to all the visceral organs, especially the kidney, the heart, the spleen, the liver, and the Ren and Chong meridians. The reason is that the production of menses and the gestation of the fetus rely on nourishment by blood. The kidney stores essence, the heart governs blood, the liver stores blood, and the spleen commands blood. Hence, it is only when the Zangfu viscera and the Chong and Ren meridians function well that the uterus is able to supply enough nutrients for the growth and development of the fetus. Dysfunction of these organs and meridians can lead to irregular menses or infertility. In Chinese medicine, the treatment method is usually to regulate and strengthen the visceral organs and meridians. Now we have an add-on or a bonus. We discussed the sperm chamber of the male. The sperm chamber is the reproductive organ unique to the male. Its physiological function is to produce and store sperm. The essence of medical classic states, the uterus in the female and the sperm chamber in the male, these are the places where blood and vital energy converge and where essential qi of yin and yang transforms into the fetus. This function of the sperm chamber derives from the kidney. In Chinese medicine, the domain of the kidney, which governs the reproductive capacity of the body, extends to include all the reproductive organs, including the testes. Hence, the testes is also known as the external kidney or the outward manifestation of the kidney. Thank you for your attention.
Let's proceed to diagnosis according to Zangfu organ patterns with a pattern urinary bladder damp heat. Urinary bladder damp heat is typically an acute disorder. It can often develop into a chronic condition with acute episodes. Many women find that they suffer from recurrent urinary tract infections and that these infections increase in frequency. These infections are often treated with Western medication. Unfortunately, these pharmaceutical products often have a double negative effect. The Western medications clears the heat aspect of the disorder, but does not address the damp aspect. This means that there will remain a lingering damp pathogen, which will start to generate heat, resulting in symptoms of a new infection. Furthermore, due to its cold nature, the Western medicine weakens kidney and spleen yang, resulting in additional dampness that seeps down to the lower jiao, laying the foundation for a new damp heat condition in the urinary bladder. This is again treated with cold medication that does not drain the pathogenic qi completely out of the urinary bladder, but increases dampness, and the vicious cycle is started. Damp heat, as stated earlier, often arises when damp cold transforms into damp heat. This transformation will accelerate if there is already heat present in the body. An excessive consumption of food and beverages that are energetically hot, stress, and qi stagnation heat are typically contributing factors. Now let's look into its etiology. Invasions of exogenous damp, cold, and heat, dietary factors that produce dampness and damp heat, as well as repeated use of medicines that are energetically cold. Stress, emotional frustrations, pent-up anger, hatred, jealousy, and irritation can cause liver stagnation, heat, or heart fire, which can drain down to the urinary bladder. The symptoms and signs are as follows: burning, stinging sensation during urination, frequent, urgent, but scanty urination, difficulty urinating or in fully voiding the urinary bladder, dark, yellowish, turbid, and odorous urine, possibly blood in the urine, tightness and distension above the pubic bone, thirst with no desire to drink, a fever or feeling of heat in the body, yellowish, greasy coating on the root of the tongue, raised red papillae on the root of the tongue, rapid and wiry or rapid and slippery pulse, and the chair position may be full. The key symptoms here are burning sensation upon urination, urgent but scanty urination, dark and cloudy urine, greasy yellow coating on the root of the tongue. For the treatment principle, we drain damp heat from the urinary bladder. And for the acupuncture points, we can choose from REN2, REN3, spleen 6, spleen 9, LI11, bladder 22, bladder 28, and bladder 32, and use the draining needle technique. For the explanation on the choice of points, REN2, REN3, bladder 28, bladder 32 drain damp and heat from the urinary bladder. Spleen 6, spleen 9, bladder 22, and LI11 drain damp heat. As a relevant advice, when there is urinary bladder damp heat, the person should avoid foods and beverages that generate damp or heat. They should avoid exposure to climatic influences that can result in damp, heat, or cold invading the body. They should also avoid stress and situations that can result in emotional frustrations. Urinary bladder damp heat can be caused by the following patterns of imbalance: damp cold, damp, liver qi stagnation, and urinary bladder qi stagnation, heart fire, kidney yang deficiency, and spleen qi deficiency. In turn, it can result to kidney yin deficiency, phlegm, urinary bladder blood stagnation, and qi stagnation. So to summarize, damp heat in the bladder has its etiology in excessive exposure to exterior damp heat or dampness or cold, emotional strain. Its underlying or accompanying pathology are dampness and heat in the bladder. Possible presenting conditions: urinary tract infections or urinary calculus. Signs and symptoms: frequent and urgent urination, burning urination, difficult urination, dark yellow turbid urine, blood in the urine, fever, thirst with desire to drink, hypogastric fullness and pain, feeling hot, and sand and stones in the urine. The pulse is slippery, rapid, and wiry on the left rear position. The tongue is thick with sticky yellow coating on the root with red spots. The treatment principle: we clear heat and disinhibit damp in bladder, free waterways, disinhibit water, and free lymph. For the acupuncture treatment, spleen 9 for damp heat in the lower burner, bladder 22 to open the lower water passages, Stomach 28 to regulate the bladder and urination. Bladder 28 for dampness in the bladder. Spleen 6 for damp feet and the lower burner. Ren 3, the promptly point of the bladder. Ren 9 to resolve general dampness. With needle with drainage for small amounts of red urine, we use DO 27. For pain on urination, you can use liver 5 and liver 2. For blood in urine, you can use spleen 10 and bladder 60. Thank you for your attention.
Let us go to etiology in Chinese medicine. The topic is stones. Stones are formed when turbid dampness and heat accumulate in the body and are heated for a long time. The most common stones are those of the stomach, the gallbladder, and the kidney. Stones are the result of certain pathological processes, but are in turn causes of additional illnesses. Now let us look at the formation of stones. Unbalanced dietary preferences. Chronic unbalanced preference for greasy and sweet foods or indulgence in alcohol and milk can affect the digestive functions of the spleen and the stomach. This leads to the generation of endogenous dampness and heat, which accumulate in the liver and the gallbladder. They form a mass in the gallbladder, and after a long time, it transforms into a stone. If dampness and heat lodge in the lower jiao and disrupt qi transformation, they may turn into stone in the kidney. Inappropriate diets. Eating too many persimmons or dates on an empty stomach, especially if raw or not peeled or with seeds, can interrupt the stomach's decomposing and descending functions and lead to stomach stone. Also, in some localities, the quality of the water supply may also contribute to stone formation. For example, regular drinking of very hard water can lead to kidney stones. Next is internal injury by passions. Disharmony of mental activities and passions and stagnation of liver and gallbladder qi can disrupt the liver's facilitation function and the smooth secretion of bile. Mixing of bile with dampness and heat for a long time can lead to the formation of gallstones. Next is erroneous herbal medicines. Long-term intake of medicines containing calcium, magnesium, or bismuth can affect the stomach's decompositions of foods and downward transportation of chyme and lead to stomach stones. Long-term intake of certain alkaline medicines or mineral medicines can affect the transformation of kidney and bladder qi, causing impeded water flow and kidney stones. Now let us look at the characteristics of stone-induced disorders. Stone mostly affect the fu organs. Though kidney stones are seen clinically, most often they are gallbladder stones, stomach stones, and urinary bladder stones. The reason is principally because all 6 fu organs are hollow and convenient locations for stones to form. Prolonged course and varied symptoms. Stones form from stagnant qi and blood due to dampness and heat. Apart from stomach stones, the others form after a prolonged course. Clinically, the symptoms vary considerably depending upon the size of the stones and their location. In general, small stones tend to cause milder symptoms, sometimes even without symptoms, whereas large stones tend to cause more severe symptoms. Ready blockage of qi movement and injury of meridians. Stones have material form. As they lodge in the organs, they readily impede qi movement and actions. This in turn affects the circulation of qi and blood, the metabolism and transportation of food and drink, and the excretion or secretion of fluids. Stones in the stomach, for example, can inhibit stomach qi movement and affect the decomposition and transportation of water and grains. The stones may even pass down to the intestines and cause blockage there. Stones in the gallbladder can affect the conducting and dispersing function of the liver and gallbladder, and the normal excretion of the bile. Stones in the kidney and the urinary bladder can lead to disturbance of water metabolism. In addition, stones may damage blood vessels and cause bleeding. Colicky pain. When stones lodge inside the body and affect the free movement of qi and blood, in general, there are regional distension and pain. When a stone blocks a passageway, severe colicky pain can develop. For example, gallstones can produce severe cramps in the right flank, which radiates to the right shoulder. Kidney stones can produce severe cramps in the waist and pelvic abdomen, which radiates to the insides of the thighs. During attacks of these cramps, the pain is difficult to withstand and is often accompanied by cold sweats, nausea, or vomiting. Phlegm, rheum, blood stasis, and stones are material products of pathological processes. They share the characteristics of blockage of qi movement and prolonged course and a wide variety of symptoms. There are differences, however. Phlegm and rheum flow with qi and blood throughout the body, and their effects are diverse and unpredictable. On the other hand, though blood stasis and stones can occupy different locations and show varied symptoms, the pain of blood stasis tends to be sharp and stabbing, whereas the pain of stones tends to be colicky. Thank you so much for your attention.
Now let's talk about the emotions. Shame. Shame is a common emotion in Western patients. It may be caused by a feeling of shame about one's behavior, but more commonly, it is an innate feeling of shame due to one's upbringing. It is a feeling of worthlessness, an absence of a feeling of self-worth. It is, in a way, the opposite emotion to anger and pride. Anger is outwardly directed, like I am angry at someone, while shame is inwardly directed. It is self-accusation. A feeling that one has to hide is an important aspect of shame. When affected by shame, one feels judged all the time. According to Solomon, in small doses, shame may be an affirmation of one's autonomy, a confirmation that one will live by one's standards and accept responsibility. According to him, although opposite to pride, shame is similarly conducive to self-esteem. It is easy to feel good about oneself when one has no values, when one refuses to accept responsibility for one's action, or when one happens to not have done anything wrong. The ability to admit and atone for one's mistake is as essential to wisdom and personal dignity as the ability to love other people. However, in severe cases, which are the ones that concern us when shame becomes a cause of disease, shame is overwhelming and it is self-demeaning, extremely defensive, and impotent. As a cause of disease, we consider shame that is overwhelming, that is, due to one's upbringing and is not related to one's action or to having done anything wrong. A person suffering from this shame will always feel as if they had done something wrong and will want to hide. It is often said that Western societies are guilt-based and Eastern ones shame-based. So it is useful to explore the differences between shame and guilt. Shame is related more to one's place in society, what people think of us, the feeling that one has to hide because one has done something wrong, something that society frowns on, something dirty. In other words, as long as we do not do anything that society disapproves of, or most important, as long as we are not seen, not found out to be doing something wrong, we do not feel shame. By contrast, in such situations, we would feel guilty even if nobody sees us doing something wrong. One could say that with guilt, we hear a voice condemning us. With shame, we see people condemning us. Therefore, shame can be avoided if we are not seen doing something wrong. Guilt is unremitting. We cannot avoid it even if nobody sees us because we hear the voice of the inner judge condemning us. What is paramount in shame is how one appears to the other members of the community, not how one feels inside. Guilt is a darker emotion, more inwardly directed, an emotion from which there is no escape. The judgment is there, whether anyone sees us or not. The big difference between guilt and shame is that guilt has no redemption and it eats one from the inside forever. Shame has redemption and repair. It is certainly true that Eastern societies are shame-based, probably due to the strong Confucian influence. However, that does not mean that shame is not a prevalent emotion in the West too. As the Confucian ethic is all about social relationships and about one's place in society and conforming to strict rules of conduct and social hierarchy, it is natural that shame ensues from contravening the established rules of society. Thus, people are worried about being seen to be doing anything that society would frown on. That is why shame can sometimes produce extreme consequences, as when Japanese businessmen commit suicide when they are disgraced socially. It is probably also for this reason that anger plays such a prominent role in the emotion causes of disease for the Chinese. Anger is probably the most disruptive of the emotions from the social point of view, and an emotion that can potentially challenge and disrupt the social order and hierarchy. The Confucian gentleman never gets angry, and it is shameful to be seen to be angry. However, shame is common also in the West, and I would say more in Protestant countries with a strong Puritan tradition. Thank you for listening.